Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see. So I'll be brave if you're brave. I'll be brave, but only if you're brave.
Good evening, everyone. Welcome to tonight's Lung Cancer Living Room. So happy to see all of you here, some familiar faces and some new ones. It's always a pleasure. We're so excited to have you here tonight, to be back in South Florida with Dr. Raez and team. Just to let you know, Drs. Botero and Terasi are running a little bit late, but for good reasons, because they are with patients, just like some of you who needed their attention. But as soon as they get here, we will make sure to have them seated. I'm going to do a little bit of housekeeping before we get started. If you have cell phones, if you wouldn't mind silencing them, that would be great. I also want to let everybody know that we do this meeting for you. So if you have questions, please don't hesitate to raise a hand, and either myself or Nanette, who's in the back of the room in a beautiful green dress, will make sure to get you a microphone. The reason the microphone's important is because, as you may or may not know, we are live streaming this. So folks around the country and around the world get to benefit from the discussion here tonight and from some of the stories I'm going to ask some of you to share. My name is Danielle Hicks. I oversee patient services at the foundation. Some of you may or may not also know Bonnie J. Adario Lung Cancer Foundation has very recently, within the last 6 weeks, merged with the Lung Cancer Alliance. So we are now Go-To Foundation, which what that means for you guys is we are literally the go-to place for any and all of your needs outside of your obvious clinical care team. We're very, very excited about the merger. We have more patient services to offer. We have more options for research, more options for development and fundraising, and all the things that need to happen in order to ensure that we can get approvals and new things happening in this space so that Dr. Raez and team can bring them right back to you. So that's a little bit about who we are. This meeting usually starts with an around the room. It is not mandatory. You do not have to introduce yourself and speak, but we do love to hear stories and folks chiming in either live tonight or those that will come back and watch post-live later really like to feel like they're not alone. I know in talking with patients over the last 11 years, and one of the reasons this program even began to begin with was because patients I was talking to said, I've never met another lung cancer patient, right? And that it felt like a really lonely place for them. So here in this room and live tonight and then post-live after, it creates a community that you can all be a part of. So thank you for sharing. Once that is done, I will come up and talk a little bit more about what we're going to be talking about tonight, and then I will ask the panel to introduce themselves. I've also found over the years of doing this that rather than me looking down at a piece of paper and reading bios of our panelists, it's way more meaningful and personal to have them kind of tell you who they are and why lung cancer is important to them. So with that, I'm going to ask some brave volunteer to, I'm looking right at you, you're going to do it, right? Because you're smiling. I'm going to hand you a mic.
All right. I actually prepared something a little while ago. Well, I'd like to begin by thanking the Bania Dario Foundation and any and all other sponsors and helpers who put together functions like this, living room event. 'Cause gatherings like this are an incredible source of support and education and inspiration for so many people. And I'd like to thank all the doctors and specialists and researchers, who work tirelessly against what must seem at times as insurmountable odds. I'd like to give a special thanks to all the nurses and technicians and admin who really do most of the heavy lifting and who sometimes still find the energy to somehow show us compassion and encouragement. If there's one thing that I could give to anybody who may be going through a challenging time, it would be a message of staying disciplined. If there's one thing that I learned from this experience is that life is short and unpredictable, and none of us know how young we are. And what I've come to find out is that the best way for us to maximize our time is for us to live a disciplined life. Learning to love discipline has helped me to figure out what are the most important things that I need to do in order to get the most value out of whatever time I might have. Discipline has taught me how to prioritize both my thoughts and my actions, and has helped me to stay on task with all the things that I need to do, like eating right and exercising and staying focused on the activities that help us to get to the destination of our choice. Learning the love of discipline has also taught me which thoughts and actions to avoid, like staying away from certain people and places, avoiding certain foods, and most importantly, the type of emotions and thoughts to avoid. Like the times when I want to somehow believe that I know more than doctors, for example. And I was definitely like a Google doctor expert, and so you guys were super patient with me, and I really appreciate that. Essentially, discipline has taught me to learn humility and gratitude, and I'm thankful for this experience. It's given me an understanding of important things like time and energy, and where you put your energy and how important that is. And so I'm thankful for places like this that let me express those thoughts and put them together and express them and help me meet people that inspire me, that show me that there's a lot to live for. There's a lot to come, and again, thank you to Bania Dario and Daniela and everybody who makes all the research and all any and all aspects that end up helping people like myself and anybody who's going through a challenging time. So thank you, everybody. I was 3 years. 3 years, yeah. And I'm in better shape than I was 10 years ago. I'm running laps around 20-year-olds now. So. Come on, you gotta share your story. Your stories.
You certainly don't have to stand up.
Okay. My name is David. I am a lung cancer survivor. I started this journey 9.5 years ago, going on 10 years. About 3 years ago, they found it metastasized to my stomach. Then about 2.5 years ago, they found that it had metastasized to my brain. I had 8 tumors. Dr. Botero's not here now, but she performed cyberknife on me and got rid of them all. And then about a year ago, year and a half ago, they found 11 more. So Dr. Botero went at it again. And, God is good all the time. And here I am. I didn't think I was going to be able to see my daughter's 15. But here I am. Thank you, Dr. Raez.
Great. You don't have to be impatient to say hello if you want to say hello. Anybody?
I didn't say that much. My name is Maritza Torres. I have lung cancer when I was 54. Thank God I did all my treatments and I'm in remission. And, I'm hanging in there, and thank God and Dr. Reyes and his staff for keeping me alive. Thank you.
I'm kind of shy, but my name is Frances, and I have stage 4 lung cancer. My husband actually saved my life, as the doctor said. He made me go for a PET scan. It'll be 2 years. It was in the middle of 17, and they saw something in my lung. And they watched it, and after 6 months it grew. And they told me from the PET scan, it didn't light up, that if I removed the top section, I would never have to go for treatment. And I wasn't really the kind of person that would go for chemo or that type of stuff, so I jumped at it. Well, when they opened me, it was in my lymph nodes. My family didn't tell me. I never realized how much I was loved until this happened to me. My family came from cousins, friends, all over, and slept with me and took care of me. And the lung operation, I was in and out of the hospital. It was VATS with Dr. Quinn in Miami. He was fantastic. I was home in 2 days. And then they had to take a biopsy. And the first oncologist I had did not read it properly. He just read the impression, and he told me chemo, and 2 other oncologists wanted to do chemo and radiation, and I said, I'm not doing it. I was scared because I saw people suffer from it. So I had a specialist read my report, and he saw in the report that chemo would not work on my cancer. It was like God sent me a message not to do this. And I believe in that because I've had 3 miracles since. And I'm very thankful for Dr. Santos. Sorry he isn't here. But he, after I went on Gilitrif for a while, I got very ill. I was losing my hair, my nails were falling apart, and it was very difficult. So I stopped it, and it metastasized to my brain. That's when I met Dr. Santos, and he made me go to Dr. Botero, and she did what you said, cyberknife. I had 1 the size of a quarter in my brain. I had fluid to my brain, and thank God, I don't know how my family handled me, but they put me on steroids, and I wanted to throw out everything in the house. I wanted to clean every drawer. I was everywhere, and there was no controlling me. But my family stood by me. My brother said to me, I don't know how many times, when am I going to get my sister back? Where did she go? Everybody was very concerned. Dr. Patero saved my life. And Dr. Santos, I'm sorry they're not here to hear this, but I am very thankful for them. But it did come back, and now I'm on Tagresso. Again, I lost my hair from it, which they told me I wouldn't, but I was almost bald, but you could see it's coming back. Thank God, this was all gone. And I just cut it short and let it go gray and said, thank you, God, for everything you've given me. And I actually had another tumor that went to my chest, and I prayed to God to take me out of this place. I didn't want to, they wanted to go in my chest, and I could bleed to death, and my lung could collapse. And I kept saying, I don't have a tumor. Well, they took an x-ray, and there was no tumor. So that was my second miracle. My third was Dr. Patero. She said, I'm doing better than anyone. Right now, I am totally clean of everything. It's all gone, and I had many tumors in my head, but the Tegresso took care of them. I didn't need the cyberknife on that. And discipline is one of my biggest things is food. And I use a product called frankincense. I believe in it, and I actually believe it took the cancer. My arm was full. It was eating my bone. A year before it was seen in me, my granddaughter couldn't touch my arm. I would scream. I didn't know at the time that I was sick. And I had to get, they wanted to do radiation to my arm, but they had to operate and put a rod in my arm because they said it would break. Well, when they put the rod in my arm fractured. And that was the worst part of my whole experience for 2 years. The pain was unbearable. And they couldn't give me the radiation because I was operated on, so I kept putting frankincense on it. And when my arm healed from the operation, I told them I wanted a test before they gave me the radiation, and it was gone. So I believe that my food helped me. I've never been sick other than my arm. I've always felt good. Like you said, discipline, believe in God, believe in what you're doing, and be thankful for every day you wake up. And that's how I live my life. And thank you, honey.
Thank you, Francis, for sharing that, and we will make sure to get a clip of that to both Drs. Santos and Patero so that they can hear it for you. Yeah. Anybody?
Hi, my name is Dave Coda. Mine's kind of funny because, excuse me, I was diagnosed 14 months ago, and the only issue I had was having severe back pain, and I thought I heard it at the gym. And I was doing a lot of working out, and I was biking a lot, no shortness of breath at all. I end up doing chiropractor, acupuncture, and nothing seemed to help. End up getting an MRI of my back, and I got a call the next day to say, I need to start the process of getting a PET scan. And that's when they found out that I had bone cancer, bilateral lung, and brain cancer. Sorry, I'm a little dry. And I just found it kind of funny because I was doing everything and I wasn't short of breath. So that started the whole process of radiation, cyberknife, chemo, immunotherapy. Right now I had a side effect from the immunotherapy. So we're kind of in transition right now to figure what the next step is. So I'm not really we're not sure what the next step is for treatment, but I'm grateful I'm alive, and I'm grateful for the whole team. I see Dr. Hussein and his team. I've seen Dr. Patero quite a bit, and thank you very much for having us here.
Hello, I'm John Carrasco. I'm a caregiver / advocate for my dad. He was diagnosed with cancer November 26th of last year, stage 4. They went to Memorial. They ended up removing the tumor from the brain at that time. He was under the care of a medical center, which is pretty well known in Dade County. I really wasn't happy with the service he was getting there. So I ended up reaching out to a bunch of different doctors. They ended up sending the tumor to get Caris tested for the genetic arrangement. The doctor, his oncologist at the time, told us that she was set on giving him chemo. She said there was nothing on that Caris report that would dictate otherwise. I wasn't happy with that answer, so I kept pushing. I reached out to 2 doctors at the university. a doctor in Washington, D.C., and Dr. Raez, and they all told me that his genetic arrangement allowed him to have targeted therapy. Took some convincing. I got my dad to switch out from that medical center, got him into Florida Blue, and then now he's ultimately in the care of Dr. Raez. And we're very, very happy with the treatment that he's getting so far with him and his team. So the one message I will say is don't give up and never take no for an answer. If I would have, he'd probably still be at that medical center getting chemo, which is what they were going to give him. Actually, they did. They gave him 2 sessions of chemo for no reason, in my opinion. So I say speak up and keep getting opinions. So.
Well, good evening. My name is Dr. Miguel Montilla. I'm a retired dentist. And 5 years ago, I went to see my doctor. I didn't feel like myself after I had a head cold. And the guy saved my life because I've never smoked cigarettes in my life. My entire life I spent doing sports, eating well, taking care of myself. And so he said, look, we haven't taken a chest x-ray in a while, so let's go ahead and do one. And actually, the pulmonologist was a friend of mine, and we're sitting talking, and I hear him say, hey, I don't like this. And I had a tumor in the upper lobe of my left lung. How that happened, I don't know, but it did. I had it operated. Who's been, I consider a friend now, Dr. Raez. And so I've been seeing him for 5 years. I feel extremely lucky that I had no metastasis. I'm at stage 1. And I had to go through the CAT scans every 3 months because I refuse to get chemotherapy or any of those other treatments. And right now I feel back like myself. And what it's done, it's changed the outlook of my life. I suck the life out of every day that I live now. And it just puts things into perspective. And I'm very happy to be here, and I wish everybody here in this room the best of luck.
Hi, my name is Robert DiPasquale. I'm only into this it's 11 months now since I was diagnosed. And since then I've had treatments of radiation, back surgery, and I had stage 4 lung cancer, and it metastasized to my vertebrae, my T5. So with everything that's been going on, it was scary at first because I didn't know what to expect. But now I'm feeling very good. My back is healing up. I'm doing more and more. And Dr. Raez has got me on a regimen for myself with the Keytruda and some other stuff, and then working on stuff just for me, which is amazing that they're targeting individuals for their own, specific things. So, and when I first came here, I had only been diagnosed a month. So I was scared. But then I met people who were 12 years in, 10 years in, 8 years in. So that makes a big difference to your mindset, So the way I feel now, Dr. Raez and he says I'm supposed to come to 10 more dinners, so he must have a plan for me. So I plan on being here for 10 more dinners. So yeah, I feel good, and it's amazing what's happening with the study of cancer and how they're progressing. So lucky to be at this time. Not lucky that I have cancer, but lucky that this time is where things are evolving and things are changing and different medicines are coming up, and it's amazing time. So, don't despair. So, thank you.
Hi, my name is Harvey. This is my beautiful wife, Fran, sitting next to me. It's been a blessing. And I have stage 4. I have non-small cell lung cancer. I've had it, it goes back. Last year in August, my wife and I were climbing hills in Washington and Oregon on a bus tour, and I had no symptoms. I came back went to a regular routine exam. Found my doctor told me I lost 10 pounds. Any reason? I couldn't see any reason. Wasn't doing that much exercise, and I thought I was eating pretty good. We did some tests and found out that I had non-small cell lung cancer, and I've never smoked a cigarette in my life, which kind of was surprising to me. But I was fortunate enough to be referred to Dr. Raez, and he has been absolutely fantastic. I mean, he and his staff, they're just terrific. They answer all the questions. They don't rush, and I was also very fortunate to have the ROS1 gene, which enabled me to do a chemo pill, Xalkori, instead of the normal chemo, and I'm very, very thankful for that. And through Dr. Raez's treatment, I've progressed from a wheelchair to a walker to a cane, and basically now around the house and near the house, I don't even need that. And I'm going to close in thanking my wife, who, without her, I don't know where I'd be right now. She's been absolutely wonderful in making sure that I follow all of Dr. Raez's orders. So that's it, and I wish everybody luck here. I'm a newbie at this. I hear so many years of so many people here, and I didn't even hit one yet. So thank you very much.
Coming over. You guys can talk if you want to introduce yourselves.
Hi, good evening. My name is Vernon Ashby. I was diagnosed about a year and a half ago. This one can tell you the fear that I had thanks to her, of my diagnosis. But I was very fortunate to be referred to Dr. Raez, and he assured me from day one that I'll be okay. I went through radiation, chemo, and let's say I'd never smoked a day in my life, either too. So, and he stopped the chemo and put me on the immunotherapy, and I successfully rang the bell 2 months ago. So now I have to be monitored. So, I thank God every day for everything that the support system that I received. I've been working for the system, Memorial System, almost 31 years, and have to be on the other side of the track. I can see, the care that is given at the hospital, not because I work there, but the support that I've received is unbelievable. They're always just a phone call away. And Dr. Raez always come in and make me smile. Yes, she always makes me smile, It makes it easy for me to go through this. So, I'm hopefully that I can, and like I told him, I said, I don't mind visiting you, but not in that chair. But thanks for everything. So far, still a little residual effect from it, but, I'm very fortunate and positive through everything. Thanks.
Hi, I'm Audrey Ellen, and Dr. Raez has been my hero since January 2008. At the time, from what I understood, a lot of doctors weren't checking their patients for brain metastases, although I had learned that 35% of those with lung cancer did have some sort of brain metastasis. So again, I was very fortunate that he covered all the bases. It's good to see familiar faces here. and some new ones. I can't tell you how fortunate you are to be here with this group, with Dr. Raez, with Bonnie Dario, and all the wonderful research that they're doing. I was re-diagnosed in December of 2018, and fortunately, my cancer was small enough to receive CyberKnife. I had my 3-month scan 2 weeks ago or so, and everything is stable. The main thing that I'd like to get across is never lose hope. Live your life for yourself, live life for you, live life for your loved ones, and live life for those who are no longer with us. We owe it to us all. Thank you.
My name is Richard. About 5 years ago, I was at work and stretched. I just did a stretch, and I felt really uncomfortable on one side, and I tried to walk it off, and I couldn't. And I guess the net of it was is they took me down to the emergency room and did an X-ray, and the net result was is that I did have a cancer, and I never smoked, and it was a stage 4 lung cancer. Initially, I was on chemotherapy, and later it was CyberKnife and immunotherapy. And it's been close to 4 years that there hasn't been a sign of the cancer. So I'm very happy. And kind of needless to say, Dr. Raez was my oncologist from day one. So I'm very grateful for that being the case. Thank you.
Hi, I'm Natalie. I'm Idy's daughter. So when I was in 5th grade about 11 years ago, she had an ovarian cyst rupture. And when she went to the emergency room, that's when they found that she had lung cancer. It was super unexpected. She's a non-smoker as well. And 7 years later, they found it had come back. She were in remission for about 7 years, right? And it came back, and it was stage 4. And through more chemo treatments, radiation, now she's scanning clear for 4 years.
Hi, my name is Paul. I'm Audrey's husband. And first I want to say thanks to Dr. Raez. He's been her savior since day one. Her initial diagnosis was not with Dr. Raez. We'll give you 6 months and keep you comfortable. That was 12 years ago. And we got to the point, at least in my thinking, that the last couple of years when she would do yearly scans, I was just at the point, well, every year the scan's fine, so it's good. And she had the scan done about 6 months ago, and I thought nothing of it until they said, well, you've got cancer in your other lung now. That's when I realized you still have to have a lot of hope. And thank God you have Dr. Raez and the team. Just have hope and be lucky enough that you've got this man and his people, because he is the savior.
Thank you. Thank you.
I want to thank Dr. Raez, because without him, I don't think I'd be here today. He's always been there for me. His team is awesome. Anytime I have a problem, I can pick up the phone and call them. They're always there for me, and I appreciate it. Thank you.
Thank you.
Thank you, everyone, for sharing your stories with us. It's very personal, deeply personal, and the fact that you're willing to come here and do that means a lot, I know, to everyone in the room, to all of us at GoTo Foundation, and to everyone watching. So thank you, thank you. Michelle, does anybody online want to say anything, hello or anything? Okay. So I'm going to ask the panel to introduce themselves, and then I will do a little introduction into the conversation tonight.
Hi, I'm Dr. Domingo. I'm one of the lung cancer specialists working at Memorial, along with Dr. Raez.
Oh, my name is Dr. Raez. 22 years ago, I decided to dedicate my life to fight lung cancer, and it has been a long journey, very intense. I suffer with you too. It's not easy for me to see, but I also am very happy for all of you when we have success stories. And I get the congratulations and the accolades, but as many of you have said, it's a huge team, So I am very lucky to have Dr. Domingo that works with me, Dr. Brian Hunis that is not here, Dr. Atif Hussein, Dr. Whitling. We have a lot of doctors at Memorial that works with us, and then we have the surgeons like Dr. Tarasi. We have navigators like Michaela. We also have here our other navigator, Alba Baglietto, that is in the back. We have Paola Izquierdo, is our nurse practitioner. We have Marai Salina, is our director of support services. We have John Brown, is our administrator that takes care of our lung cancer team. It's a huge team. It's a multidisciplinary team, and without the team, we cannot do anything. That's why I always get the accolades. Honestly, it's a big effort. It's a big effort. I don't know how many we are. Maybe we are 20 people, 25 people that fight lung cancer for you. Not only in our institution, Also, you mentioned Dr. Santos, Dr. Santos and his team in Boca Raton does a great job. We have Dr. Mudad and Dr. Johansen, University of Miami, Dr. Estela Mari Rodriguez that was here last year in Mount Sinai. We will have all these multidisciplinary teams, and tonight we're going to share a little bit of what we do, and we fight for you. But we also need your help. That's why we're here. Advocacy is very important. We need more funds for lung cancer research. And we have now the Boni Dario Lung Cancer Foundation. We have the Lung Cancer Alliance. Now we call them the GoTo Foundation. We need your support because we need more money, more funds for lung cancer research. As you can see, many of you are alive thanks to target therapy, thanks to some pills that we have now because we have discovered genes and we have targets for these genes. We only have treatments for 5 genes, and there are 70 genes that we can isolate in lung cancer patients. So we have many more treatments for more genes. So instead to give you empirical chemotherapy, we can give you what we call precision medicine, one treatment for each patient that works. And then 10 years later, we have a great successful story. That's why everybody that is watching online or watching in YouTube, we need more support. We need to support these lung cancer advocacy organizations. And I guess you are the patients and the caregivers. Sometimes when I talk about this, they say, "Oh, you are the lung cancer doctor, but you don't suffer." They listen to you. That's why we need your help, and you need to fight together. No?
Good evening. My name is Michaela Roldan. I have been a nurse for the last 8 years with special interest in oncology. I have geared my career to help patients from the research standpoint, and for the last 2 years, I have been a navigator, helping Dr. Hunis, Dr. Sarsfield, and Dr. Hirsch to help patients with lung cancer and head and neck cancer. I'm very passionate about my role as a navigator at Memorial Cancer Institute, and I feel like I have found my calling to help patients like you. Thank you.
My name is Francisco Tarasi. I'm a thoracic surgeon at Memorial, part of Dr. Raez and Dr. Botero's team. And we dedicate our practice to benign and malignant conditions of the lung and do the lung cancer surgery at Memorial.
So thank you all for your introductions, and I just want to reiterate something Dr. Raez said about this team at Memorial, and we've been working with them for several years now, and I'll never forget the first time we came out to meet with her, and we met with the entire team, and it was very overwhelming walking into that room, but I can tell you that what he says is absolutely true. Everyone there, the care team, right down to the administration is behind this program and in this team, so thank you all for everything you're doing. Dr. Botero, you didn't get to introduce yourself. I'm sorry.
That's okay. I recognize a few faces. I'm Dr. Botero, Ana Botero, Radiation Oncology, and I work with Dr. Terrasi, with Dr. Raez, with Dr. Domingo. I think that we're all the same team, and it's always a pleasure to be here just sharing your experience with a little bit of our knowledge. So thank you.
So I'm going to turn it over to Dr. Raez in a minute. We're going to be talking about precision medicine tonight, what that looks like, what that means, one treatment for each patient. I'm excited to talk about it. We're going to talk about it kind of 3 different buckets. Like I said, please feel free to ask questions throughout. It's why we're here. There are no stupid questions, so don't hesitate, and one of us will get you a microphone. We're going to touch a little bit on early stage disease, move on to locally advanced, and then metastatic disease, and how each of those are treated in a precision way. But I want to start a little bit first, if you don't mind, Dr. Raez, and talk a little bit about screening, which I know is not necessarily relevant to anyone in the room, right? You've already been diagnosed, but you know people, right? And so being the voice out there on the streets and in your neighborhoods is really important to let people know who qualify that screening is an option for them, and that they should really do it, because when we do find it early, we're going to talk a little bit about that next. But if we could just start a little bit with screening, if somebody, maybe Dr. Tarazi, I don't know, wouldn't mind running down a little bit of the qualifying criteria so that we could educate everyone in the room and everyone watching on who they should be talking to and whose doors they should be knocking on.
Yeah. Well, the lung cancer screening has significantly changed, lung cancer, because when, as probably all of you have heard, there is screening for colon cancer, there's screening for breast cancer, screening for, prostate cancer, and there was nothing for lung out there, and people rely on a chest x-ray. They found out, chest x-rays are not as good. You could miss things in chest x-ray. And then they started looking at CT screening protocols, and when the trial came out, it was published in the New England Journal, the outcomes were so good, so great, that it was closed early because it was not fair to randomize people. And it saved more life than, if you just screen lung cancer, you can save more life than all the other cancers combined, all the other screenings combined. And it's not only important because you save lives, it's also important because in the economics, when you look at the people that look at the economics of healthcare, which cost and benefits, also diagnosing early and making early stage diagnosis and curing those patients also impact healthcare in that way. So who qualifies for that? People that is over 55, people that are either former smokers that quit within, I think it's 15 years, of people that is actively smoking. And what is the screening? It's just a low-dose CT that you get enough radiation to find an abnormal spot in the lung. And then once you find that, you can move on to a more specific testing. And most of the lung cancers, as is today, they get diagnosed late. Only probably 25 or less % of the people get diagnosed at stage 1, which is the earliest, and the one with the highest cure rate. 75 plus get diagnosed at stage, late stages, either 3 or 4. So it's important to make people aware and promote the screening, because the amount of lives that can be saved is tremendous. And the other point that is important to bring up is a lot of places are jumping into screening protocols, and it's very affordable. I think Memorial is doing it now for
$50.
Yeah, I think it used to be 100, now it's even 50, and that includes a reading. There is a lot of issues down the road to set up a program for that, but we're actively working at the system to come up with our own screening program. We do the test, and we're trying to set up the screening program. We now have a full-time dedicated person to look at that and run the program, but we're in the process of setting it up.
Thank you. I think it's just a couple of things to point out there. When we talk about, just in the United States alone, the number of people that currently qualify for the screening based on those qualifying criteria, right, which are limited because you have to have at least a smoking history, right, within the last 15 years. As we know in this room from hearing a lot of you talk, you don't have to smoke to get lung cancer. We know that, but this is a start. But between that 8 and 10 million people currently living and qualify for screening, and less than 4%, roughly, but somewhere between 2 and 4% are actually getting screened. So you can imagine the impact that screening could have simply by people being aware of it and not afraid of it. I got more radiation flying out here from California and flying back than a low-dose CT scan. So thank you. With that, I'll turn it over to Dr. Raez.
Okay, so this is not about us, it's about you, because I think we started to do this with the Bonnie and Dario Lung Cancer Foundation because patients always said, oh, you're always in a hurry, and because we see you too fast, I guess. So tonight is about you. If anybody has a burning question, I'd rather answer your questions than give you a lecture about anything. So that's why if anybody wants to ask about any particular issue, about any particular drug, any particular treatment, if not, we will start to talk a little bit about some topics, and then you are free to ask questions. Nobody here? Oh, yes, you have a question.
I have a question. I keep listening with everybody saying how all the people, like in our case, non-smokers, and people who weren't around smokers, and we have, and here we are, stage 4, we really have. Why is it that in the screening process, you're not advocating for non-smokers as well, and maybe work together with that wonderful insurance company to see if it could be included as part of a physical, part of Medicare, part of something? I don't know if age is considered a variable. It seems to me you're overlooking a lot of people, especially with all the environmental changes, the radon, everything that's going on in our universe. I think there are more people out there who are non-smokers that are not being screened that would be willing to be screened. I mean, we had no indication. There was nothing prior. I think that we're neglecting a whole group of people. The people who smoke know there's thousands of commercials every day of what you're going to have and what's going to be wrong. I think we need to target people who don't know that we're at risk. We do mammograms whether you have a history, no matter what your age, you've got breast, you have a mammogram. I think we are neglecting what needs to be the people who are non-smokers.
So what happens is for a test to work and for you to have enough positive results to save lives. For lung cancer, most of lung cancers are actually associated with for patients that smoke. Over 85% of cases are for patients that have a history of smoking. So the amount of patients that develop lung cancer that don't smoke is smaller. So it's much more difficult to prove that a test is effective in saving lives when there's such a small number of patients. And unfortunately, we do not have the evidence, clinical evidence to show that it would actually help reduce cancer mortality for that patient population. So that's the reason that the test is not usually done in patients that don't smoke. Do you want to say something?
What about all of us that grew up in the schools that had asbestos? What about the nuclear underground testing in the 1950s? We're looking at Chernobyl, we're looking at 3 Mile Island, we're looking at Fukushima in Japan that is still releasing stuff into the oceans.
No, you're
I
right.
don't understand where this is all coming from, the food chain.
No, you are correct. For example, asbestos is a very sad story because when we discovered that asbestos caused cancer, it was already too late. And the professionals that have more asbestos-related lung cancer were teachers because they were sitting in the same classroom, in the same school for 25 years exposed to asbestos, So that was a very sad story, but that's a real story. I have a patient, for example, that used to work here in America. They shut down the company and they offered him like a double salary in Saudi Arabia. So all the company moved to Saudi Arabia and all the patients went. What they didn't know is that they were exposed to asbestos. And the company, knowing that they were exposed to asbestos, they moved the factory from here to Saudi Arabia. So lately, they developed lung cancer. And he realized later that the company has exposed him on purpose. So there's a lot of sad stories about asbestos, and now we know about asbestos, and we care for asbestos. The latest one that we know is radon gas. Radon gas, you don't smell, there is colorless. Fortunately for us, it's in the soil. So if you have a basement and you live North United States, Northeast or Northwest, you may be exposed to asbestos. So if you have a basement, you need to check for radon. Places like Florida that we don't have basements, we're pretty much safe. We think a lot of non-smokers get lung cancer from asbestos, and there is a code in the builders that they are required to show a certificate of asbestos And a lot of people don't believe, so you go to Home Depot and you buy your own asbestos detector and you check your home before you buy, So that's why we do it. And there is a group of people that we don't know.
You can check the levels of radon in your house. There's a detector for that too.
So that's why, and then there is a group of people that we don't know, especially the younger ones, the 30-year-olds, 35-year-olds. Doesn't matter where they were exposed. It's too soon for them to have cancer. So that's why Bonnie Adario has a section called Alchemy, the research section. One of the studies that we do is we're trying to investigate lung cancer in young people, 30-year-olds. I have a 28-year-old, for example. Why he has cancer? Doesn't matter if he was exposed to asbestos. You need 30 years of exposure to the lung cancer. So we're afraid that maybe it's genetic. We haven't been proved yet. But we are researching young people, and these volunteers are giving us his history, his genes, his blood, and hopefully we'll get some answer why, if you are so young, you can get lung cancer, and it's nothing to do with smoking, asbestos, or any other thing that is known.
On the other hand, the other patients that it was mentioning about the Chernobyl and the other exposures to radioactivity, those patients are at risk for any type of cancer, not only lung cancer. And that specific group of potential patients are treated in different ways, depends on which part of the world you live. Some government, they don't have the infrastructure to follow even those patients. The important thing also is for the screening test, depending on what we're talking about, specifically for lung cancer, is that we cannot forget that the CT scan gives some radiation, per se. So when we talk about the screening, the new thing is also that this type of a scan that was designed for a screening test is a low radiation CT scan, which is very important because trying to do good and trying to detect early stage lung cancer, you don't want to be causing, in the other hand, to patients like you were saying, why we don't just all of us get tested? You don't want to cause cancer to patients that are totally not at risk for having lung cancer. Plus other type of cancer that are related to radiation, as I said, malignancies, thyroid cancer, etc. So it's a kind of a difficult situation. It's true that maybe other patients might benefit, like secondhand smokers. Now we have what I call the big tsunami that is coming that we don't know what exactly is going to be. That is this flavors, vaping stuff that we can spend hours talking about that. But those vaping, we don't know exactly how they are made because they come from China, they come from India, from any part of the world. We don't know what is the compounds. Basically, they are very high in nicotine. That's kind of the common denominator. And high nicotine is highly addictive, not only taking in consideration what other things they mix that potentially could be toxic. So they say there is no cigarette, they are highly addictive, and they are targeting elementary schools with bubble gum flavors. So what is coming is that for decades, we have been fighting the lung cancer and trying to people to smoke, and we have been causing some good impact, and the percentage is decreasing. But now with this new generation that is basically used to smoke or smokeless but vaping, addicted to nicotine, and they switch to cigarette. Even the people that they advertise oh, you can quit smoking with vaping. Well, the statistics show that between 40 and 60% of those patients, they do not quit smoking. They ended up with both because nicotine is so addictive. So, but 52% increase on uses of vaping in elementary school and 70% in high school. So what is coming is a new generation of smokers, no matter what, addicted to many other things. So it's very scary what is coming. And as the American Lung Cancer Society, they try to do regulations, like the minimal age to buy this vaping or the cigarettes, trying to block smoking from college, from schools. But there's certain limit that, have to be a common effort. We cannot wait that the government give us everything. We have to be common effort from patients, advocates, from patients, families, relatives, doctors, everybody. But it's not as easy thing as a screening test. Let's just do, PET scan is really good. Let's just do a PET scan at the age of 40 because I want to know if I have any type of cancer. There's involved radiation in PET scanning. There's involved radiation in mammogram. There's involved radiation in CT scan. But everything in life is versus, benefit versus risk. And if the risk is significantly less and the benefit is high, then it's approved to proceed, to do the screening.
Are there blood tests for, I know that there's the CEA, the PSA blood tests for those kind of, I'm sorry. I was just wondering about, is there blood tests for different cancers besides, I'm familiar with CEA and PSA for my husband. Is there other blood tests to test for cancer markers or?
For lung?
We have tests to detect mutations for patients that already have a diagnosis of lung cancer, but right now we don't have an FDA-approved test to diagnose someone with lung cancer. So the test that we have for screening is this low-resolution CT scan. They're working on getting something like that, but we're not there yet.
Oh, boy.
From what I hear everybody saying, the thing that I just sit back and have to still be in awe is, as an educator my whole life, I think that we are remiss in not educating the public. I can tell you in schools for all the years I was there, and I was in education over 25 years, you learned that you don't smoke a cigarette, you can get lung cancer. I can tell you today that's still the major thing. That's the major emphasis. Lung cancer is only from smoking. If you don't smoke, you're safe. And on that same note, the kids today, you talk to them. I know from my grandkids, high school kids think vaping is safe. Nobody can really implant to them this idea that it isn't safe. We've talked about where you know where your vape stuff comes from. Do you know what's going on? I think we need to do a better job as parents, as people in this room, to go out and to educate. I don't think we are educating correctly or adequately, or maybe it's my ignorance, but I don't think that we are. The CBD oil was everywhere. The kids think, oh, this is now the safest thing too. Everybody can take all of this. The kids can tell you where to get it and how it is, and they let you know.
No, the only thing I want to say is, the CBD oil doesn't have the THC, that is the strong component. But the only thing I want to say about cannabis, because we don't want to talk necessarily about that tonight, is that I think people, or some of you may have tried in the 70s, some cannabis, and what you smoke in the 70s is not what you smoke today. What you smoke in the 70s was very light, 5%. Today there are cigarettes that are 30%, 40%, 70%. So it's incredible dangerous how the concentration of marijuana is in the preparations, in the brownies, so that's why if you think, I did 30 years ago and it was okay, your kids are going to do today and it's not necessarily okay. It's much more risky. It's another level of complexity. That's why it's more complicated than that, so we have to be very careful with this. Yes, Alex?
Thank you. I really like the idea of where everybody here was mentioning how grateful they are to Dr. Raez and all the team for the help and support that you guys have provided. And I really like the idea that you mentioned of us helping you help us. So one thing that I was thinking about was, for example, a part of gratitude is not is what you say, but more what we do. And so I'm thinking about how I could help, how I could put my part in helping not just myself, but everybody else going through scenarios like that. So I'm thinking like maybe I could do something like a tithing to foundations like the Bania Dario Foundation that help support the research that goes into all these great immunotherapy pills and procedures that help us. And I'm wondering if you guys had any advice on. I'm only an individual, so there's only so much I'd be able to give. So I'm wondering if you guys had any helpful insights on strategies that we may be able to use, and this will go to you, Dr. Raez, and also you, Daniela, for to see how we may be able to maximize donations being given to research that essentially help us.
Well, you can do much more than what you can imagine. Because if you, I don't know if you're aware, but Bonia Dario Lung Cancer Foundation started with one patient. Bonia Dario is a patient. She survived lung cancer with a huge surgery, that saved her life. But she's a patient. Maybe one day she was like you, saying, oh, what I can do myself. But that's exactly what we're trying to empower you guys. You can do a lot, You can do a lot because it's your testimony. Every time that I talk about it, they say, yeah, you're talking about, but it's not you. But when you talk, you're talking about your own life. And something important that they were mentioning in the back is that we have 30,000 Americans that get lung cancer that have never smoked. Yeah, the other 180,000, they said, oh, they did to themselves, they smoke, it's their fault. First of all, I think it's wrong, because when you get diabetes because you go to Burger King, if I'm not going to give you therapy for diabetes because you went to much Burger King, you cannot start to judge people. If you get a heart attack because you're eating too much donuts or whatever, if you want to start to judge people, you don't treat anybody. Yeah? But anyway, you have 30,000 Americans that never smoke, and they get lung cancer. That's more than the whole number of non-Hodgkin lymphomas. You only have 8,000 Americans getting Hodgkin lymphoma, So lung cancer or non-smoker is a whole disease by itself. And you guys got the lung cancer, who knows for what reason that we don't know. So that's why it's very appealing, all of you that are non-smokers that are here, because that raises the level of awareness. And as I said, to give you an idea, the Department of Defense started to give funds to fight cancer, the Department of Defense. And I went 4 or 5 years ago as a reviewer. We got assigned $20 million for molecular markers. That was the time that we started to discover the molecular markers that you guys have. They gave us $20 million, but they gave for breast cancer $250 million. $250 million. And lung cancer kills 80,000 women. Breast cancer kills 40,000 women. And lung cancer kills another 80,000 males. Yeah, that's why I'm not having anything against breast cancer. It's disproportionate. That's why we need your help. We need your testimony. We need your advocacy. What you guys can do is you can go inside this organization, Lung Cancer Alliance, go to Foundation, Bonia Dario, Free to Breathe, all of this, and try to help us. Try to help us raise awareness, try to help us do fundraising, bring your family, bring the caregivers. That makes a difference for us.
I think that we're touching a point that is very important is why do we see football players wearing pink? Why do we see license playing pink? And it's not because breast is more important than lung cancer. I think that traditionally lung cancer is has been a killing number 1. Instead of that, breast cancer, for many, many years, we have the mammograms, that is early detection, highly, more rate of cure. And you see a lot of survivors of breast cancer speaking, talking, collecting fund, doing fundraisers. And if it's not creating something like this, that is amazing, but it's very difficult. Just kind of at least doing their own things in their own communities and helping raising funds and awareness. Awareness is the most important thing, I think. But on the other hand, now with all this new precision technology, surgery, chemotherapy, target therapy, immunotherapy, radiation therapy, being more, precise, we're seeing survivors. And at the beginning, I remember when I started working with Dr. Raez, how many years ago? Many years ago. And I remember that he was at UM and I was at Memorial. And eventually he moved, and we started figuring out that not everybody needs chemotherapy, not everybody was a death sentence for stage 4. I decided not to give whole brain, that it was like a big thing, and treat with stereotactic radiation, that is again precision medicine. And we start noticing, without no reports in the literature, that the patients were surviving. And I said, what is this? We have a patient that survived 5 years, 6 years, stage 4, from moment 1 of diagnosis. So I think that the main point is that now, with all the new things in medicine, thanks to the, the pharmaceutical companies, societies like this, groups like this, the American Lung Cancer Society has tons of activities. I can tell you because I'm in the board, and every 2 months we're collecting money, funds, people, awareness, speakers, events that involve the community that collects money. And we see more and more survivors. If the survivors stand up and talk and make more awareness, I can guarantee that not only we will have better results, but little by little, it's a matter of changing your environment, your close network, and participate. You don't have to reinvent the wheel if you don't have the time, the energy, the money, or whatever. But if you join the effort, it makes a difference. It really makes a difference. That issue of, the money will go for whoever is, the director, and the money goes someplace. Little by little, we're making difference. And this is the proof that making difference. All of you, that you're here. Because cancer, lung cancer, it was killer number 1. We used to diagnose the patient and think in our minds when we were just saying, whole brain, okay, in 3 months I'm not going to see you, how I'm going to make this patient comfortable. That's not the case now. When I see a patient that is a stage 4, I said this patient could be among that 20 or 30% patients that is going to be alive in 10 years. And maybe at some point, they might think that we're crazy, but we can tell the patient in stage 4, you're going to be cured. Not for everybody, but it might be for some. And that's what we have to figure out, which patients are better than other candidates for certain therapy, and basically be very precise what type of therapy and how we're going to treat that patient. And unfortunately, we're humans, and some patients cannot be saved, and it's not for lung cancer only. And as a physician, we have to help them to die with dignity, But in general, there's a big things that we can do. Every single person, every relative, is not like I can do nothing. We always can do something. Minor little things or major things, but we can create an impact, any level.
Sign me up for a fundraiser.
Give me your name, I will just call you.
I think that's a perfect segue into sort of, does anybody else have any question before I move? Sorry.
Yes, yeah, I will.
This is regarding targeted therapies and immunotherapies, and someone would say, like myself, who had been cancer-free for 10 years, 11 years, and then gets a recurrence. Now, I was treated because my tumor was small with CyberKnife. My question, however, is, what would be the protocol for one who gets re-diagnosed? Is it stage-related, how you would treat? And will these targeted, if they've had traditional therapies in the past, would any of the targeted therapies and immunotherapies, would they be candidates for that down the road? Either Dr. Raez?
Nowadays, because we have target therapy, we are trying to do precision medicine. We don't do empirical chemotherapy anymore. We do a genetic analysis of your tumor in the tissue or in the blood. And we are lucky that we have FDA-approved therapies for 5 or 6 genes that cover pretty much 20-25% of the patients. So all of these patients can get oral therapy, a pill. It's not chemo really, because there is also chemo that comes in pills. And the chemo in pill or the chemo in the vein is the same thing. This is target therapy. It's a therapy that is engineering to target a specific gene. For example, we know that there is a gene called EGFR. This gene, EGFR, creates a lung cancer type. And then we have another gene called ALK that creates a lung cancer type. So lung cancer really is a family of cancer. It's not really one type of cancer. And as I said at the beginning, there is 70 genes that are implicated here. But we have therapy for 5 or 6 so far. So that's why at the beginning of the treatment now, we are trying to identify which patients can benefit from the oral therapies so they don't have to start on chemo yet. And some of you have been on oral therapy for 4 or 5 years. We have a patient that always comes, unfortunately, I think she's busy traveling now. She's taking one of these pills for 9 years, and she hasn't come back, and she has metastatic disease to the brain, but the target therapy, because it's a specific therapy, it's what we call precision medicine, has kept her alive. Actually, I think she's cured probably after 9 years, but she still takes the pill. So that's what we do now. For every new lung cancer patient, we try to see if they qualify for oral therapy with one of these genes. If not, we try to see if they qualify for immunotherapy or chemotherapy. No? Anybody has another question?
But I think also in her case that she had very limited disease when she was found to have a recurrence. We still try to shoot for some curative treatment, which can involve either the siren knife you had or sometimes even surgery, if the patient qualifies for that.
Anybody? Yeah? Yeah, I'm sorry, were you raising your hand? Yes? No? No? Yes?
I have something to say to the doctor.
Sorry, Francis, hold on one second.
Dr. Ramos, is it? Raez. He talked about drugs and how they're much more intensified right now. I have 3 friends that lost their children because they're adding fentanyl to these drugs. And it's very dangerous. It's deadly. And it's very sad. And it's true.
Well, the problem with the fentanyl that we have is that as a cancer doctors, we use fentanyl. Fentanyl is what you get for anesthesia. When you go for surgery, you get a shot of fentanyl in the vein and you sleep for 2 or 3 hours. Okay, that's a legit use. In cancer, we use fentanyl in the patches because for 3 days you have pain relief. The problem is that they have discovered that instead to use the patch of the fentanyl, if you break the patch and you use the patch with some alcohol or liquor, it becomes a very high potency drug. And that's why we have issues with fentanyl, and now there is a lot of counterfeit fentanyl coming through the frontier, and it has become a problem. And it's a problem that affects us as a doctors because fentanyl is a great drug that we use to control pain, and now we have a backlash, from the government that they are starting to limit the use of fentanyl, but properly used, it has always been a great drug for anesthesia and a good drug for cancer, because if you get a patch for 72 hours, you have a good coverage for your pain. So it has been always a good drug for us. Yeah, no, that's to say you are right. There is people dying of fentanyl now they are using in the black market. So,
Okay, I'm wondering how can I help and we help, all of us, everybody watching also, to help you guys get more, and foundations like this get more government funding, because it seems like that could make also a huge difference. Like, do we go and start writing letters to our politicians, and what other strategies can we use to be able to help with that on that frontier?
no, what we need is really when we have we need your support when we do these things. And for example, this lung cancer screening that we were talking before, the study was published in 2010. And the government took like 3 or 4 years to get Medicare approval for screenings. For 4 years, we knew that it worked. And for 4 years, we couldn't do it because the insurance didn't pay. Because Medicare doesn't pay, the insurance doesn't pay. That's why it's important your intervention. That's what I'm saying. Through these advocacy groups, we need your intervention for awareness, for campaigns, and in that way we can move forward. For example, I'll give you a practical example. In France, molecular testing is free. If you're a lung cancer patient, you get molecular testing. And France is not the most rich country of the world. It's a good country, but they devote the resources to do free molecular testing for each lung cancer patient because they know that it can be life-saving, not for everybody, but for a group of patients. So now that's a mandatory, it's free. That's the type of legislation that can help us. Maybe we can get lung cancer screening, we can do molecular testing, Because all of these nice things that happen to all of you, some of you are alive with some target therapy for years, but there are patients that don't have access to target therapy. They don't have patients that don't have funds for target therapy. There are patients that the doctor has not do the target therapy, so they don't benefit from the target therapy. They are not here. So that's why it's very important that you get involved at some level, and you have these channels to these organizations to do it. You know.
We can find information on, like for example, the Lauderdale site to how to.
Yeah, so I want Emily to introduce herself really quickly.
Yeah.
Alex, my name is Emily. I'm the Chief Program Officer for GoTo Foundation for Lung Cancer, and I love your question. And let me first say, too, I work for the foundation, but I also have two parents with lung cancer. And my mom is a two-time 20-year survivor, so bravo to everybody here. But your question is awesome, Alex, because we have one of our principal offices in Washington, D.C., and that is because the biggest funder of cancer research is the federal government, hands down. And to put that in perspective, a few years ago, last time I checked, calendar year, I think it was 2015, don't quote me on that, probably earlier, the federal government gave $1 billion to lung cancer research. That same year, the Komen Foundation, arguably the largest breast cancer research foundation, gave $100 million. And bravo, but you see the multiplier effect that our government has to provide funding. So we are in DC watching, monitoring, acting, and we need you to come to Washington in July when we have our 11th annual National Advocacy Summit to tell your stories to your elected officials, to tell them to support historic legislation, the Women in Lung Cancer Research and Preventive Services Act, that's going to fund research, that's going to make sure lung cancer screening is expanded to people that don't currently fit the average criteria, that our government should be doing campaigns to raise awareness about lung cancer and preventive services like lung cancer screening. But we need you to come because your elected officials listen to you. So please come and please talk to me afterwards, but we can also email information out later about the summit. We want to get every state represented. Right now, I think we have close to 30. But we'd love to have a big delegation from Florida, so I hope you will all join us.
Great. We can also take advantage to talk about navigation. You know, I want to introduce Michaela because I think as we are talking about the importance of the multidisciplinary team, I think it's important that we use all of these resources. So in the Bonnie Dario Lung Cancer Foundation, we have lung cancer centers of excellence, and we require that every hospital or healthcare system that wants to be called a lung cancer center of excellence have a lung cancer navigator, because the lung cancer treatment is very complex, and we need somebody to orchestrate all of the care so the patient doesn't have to wait 2 or 3 weeks to see each doctor, you know? Can you say a couple of words?
Good evening again. I put some information together. So hoping that my message will get to you every time you have questions, concerns, or you feel like something is there that's missing, please reach out to us. I know cancer diagnosis can feel like a long and confusing journey. So we have a supportive we are a supportive and professional resource who can help answer your questions, and we can provide reminders. We can be a steady person who can guide you through this journey. We can offer comfort and to you and your family. Navigators are usually the constant care team members who can also see the big pictures and can help you oversee also the symptoms, and we also respond to the total treatment needs. With our help, the patients will not miss appointments. We will address whatever problems are coming up in the earlier stages. We also decline the visits at the emergency rooms because of our involvement as well. There is a critical window of opportunity from the time of suspicious findings through the time when the finding is actually addressed as a diagnosis and treatment. So our generic goal is to break down those barriers that the healthcare system usually wrestles with in terms of providing timely access to care ensure the patient stays connected and focused to the treatment plan that's established, and complete the cycle of care as recommended. So we recognize that every patient's case is different and is unique, and that's the starting point of personalizing care. Our role is usually complex and starts with knowing your expectations, your limitations, your priorities, your values. So the ongoing plan of care that unfolds on a daily basis involves the right attitude toward the patients, the needs. We stay proactive, we offer choices, opportunities to improve your quality of care and give you confidence and a stress-free experience. The Navigator aims to maintain a set of holistic standards and follows the patient's journey and also the changing needs from the time of diagnosis and treatment through survivorship. These standards include an ongoing assessment of the patient's needs in terms of physical, mental, emotional, economical, educational, spiritual, and family needs. We utilize effectively resources from our facility, the community. We also have national resources, as we see, to lessen the impact of cancer diagnosis and improve the patient's outcome. Here, I would like to mention Memorial Cancer Institute outstanding supportive services that are available for you. We employ a team of amazing professionals, such as psychologists, we have dietitians, we have social workers, we have chaplaincy, physical therapists, and so on. We believe that our patient will thrive, and if we treat him as an entire being and we can heal, we provide healing for the mind, body, and soul with the modalities that include acupuncture, we have aromatherapy, we have massage, nutrition, mindfulness, exercise physiology, and so on. What does it all mean for you? The complexity of cancer care is significantly reduced with the assistance of the Navigator. As you can see, the cancer may involve also a multidisciplinary approach, such as radiation oncology, medical oncology. We have pathology, genetics, and medical anything. Genetics and so forth. Research department also may be involved as well. So our efforts are actually geared to clear the path for you so you can be seen and treated in a timely manner. At the time of diagnosis, what we usually do is to assess your level of understanding after the meeting with the physician. We provide education to ensure that you understand the directions, the plan of care. We also ensure that whatever medical recommendations are set for after the visit are actually scheduled and carried out in terms of PET scans, biopsies, or whatever else is needed for that time. We also update the medical team in case there's some other needs that will come up, specific needs. We ensure that you understand also post-treatment recommendations, and you also report whatever side effects or whatever issues you might have at that time. We reinforce the availability of integrative medicine and other services available because we need to boost, and we look at boosting your well-being, your quality of care, your quality of life throughout the entire treatment and survivorship. It is important to develop trust and great customer service. We do that by understanding your culture, the family dynamics, and so on. It all has to be conducive to the patient well-being. So we make a priority to bring positivity to challenging situations. We lift hearts in dark times. We give hopes in despair for the common goal of providing the best patient and family-centered care possible. Our role is actually a privilege to be around patients and families. We help helping to cope with difficult situations and problems that you're facing. So we bring an extra layer of expertise to the care provided, and we bridge the space that may exist between the medical staff, the patients, and the family. The take-home message is that we need to keep an open communication channel with the team and the navigators. So it's critical for the patient's outcomes, and that's why we need to hear your voice. We work with tenacity to solve whatever problems and you might encounter so that you can heal better, you can be more educated, you can have more control over your treatment, and also to reduce the suffering and discomfort. So together with the team, we evolve, we adapt, and we develop strength and resilience to overcome whatever challenges we might encounter so we can beat this serious disease. It is your right to receive quality of care. It is your right to have a person available to ask questions. It's your right to get whatever information you need on time. This is something that you have to have all the time available. Okay? Thank you so much. My message is that we're always available. We are behind the scene, but we feel for you. We try to understand what you're going through and help you as much as possible. We get the message to the doctor, to the nurse practitioner. We also refer you to other services, as I mentioned. So it's very important to keep this communication open. You will see us around, throughout your visits, before or after. Sometimes we call you to ask you how you're feeling. So feel free to contact us. We are there on your side to help you as much as possible. Thank you.
Any of the patients that have come, they have any question or comment? Oh, you have a question here. Asha.
I don't want to get up, but thanks, Mom. This is my mom. My name is Asha, and I'm 48 years old. I was diagnosed with stage 4 lung cancer in early November. After having a cough, a very slight cough for a couple of months that didn't go away with antibiotics. I was a pescatarian, yoga, devotee, non-smoker, very active physical lifestyle, and it came as a complete shock to me. I was living in New Jersey at the time. I have a company up in New Jersey, and my parents live here in Boca Raton. I immediately completely transformed my life. We decided to move down here to South Florida to be near Dr. Raez and his team, and my parents. It's been an amazing journey for me personally. I have the EFGR mutation. Is that what it's called? EGFR mutation. And I'm doing well. I just wanted to make a comment that I interviewed at least 5 oncology teams on the Eastern Seaboard for my care, including Memorial Sloan Kettering, and I chose this team because of their extraordinary quality of care, their compassion, their kindness, their cutting-edge technology, and their navigator services as well. So I just want to take this time to thank Dr. Raez and his team. I'm deeply grateful, so thank you.
Thank you, thank you.
Anybody else? No? Well, it's good because we've only got like 10 minutes left. So any final thoughts from the panel before I close out?
As we said at the beginning, we are doing precision medicine, so that's why we have a lot of hope now. In the old times, we used to give you chemotherapy, and it was very sad to me because usually the patients ask if he's going to work, and I didn't know. I know the statistics. Half of the time it's going to work, half of the time it's not going to work. It was very frustrating because some patients, ended in the no-work side, and then the second time that another chemo ended in the no-work side, and the third time no-work side. The patient said, when is going to work? And we never knew. So nowadays, I think since all the research as Audrey was asking, we do now a genetic analysis. We know that some of you are going to respond very well to these target therapies, to these oral therapies. So now we're doing a more rational medicine. We're customizing the medicine for each patient. So these are great times. That's why we have a lot of hope now. We have patients live for years now. And now that's the task that we're empowering you guys to do it. We never had advocates before because nobody survived. That was a very sad. I never had a survivor to take with me to anywhere. Now you guys are surviving, and hopefully some of you are cured. And now that's why we have the opportunity to also make a difference, for the new patients to come. So we only have target therapy for 20 or 30% of the patients so far. But the horizon is moving very fast. We have 5 or 6 pills approved in the last 5 years. There is a chance in the next year that maybe 1 or 2 more pills will be approved, and hopefully we'll continue that pace every year. Also, the immunotherapy is doing great. Some of you have been cured, I hope, with immunotherapy. We don't know yet. We are waiting. And that's another important discovery that we have. That's why the important thing is never lose hope. We'll keep you busy because we need your help, and we're going to give thanks to Bonnie Adario, Lung Cancer Alliance, now the GoTo Foundation, because I have to putting us all together, and we also have to give thanks to the industry for supporting all of these educational events and for discovering all of these drugs that are making a difference in our lives and the lives of our patients. Thank you.
Thank you, Doctor.
How many years does it take for a new drug to be approved?
Normally it used to take 10 years. 10 years since that we give the first drug to the first human until the FDA approves. But now that we have all of these new target therapies, the FDA broke the rules, their own rules. So now we are approving drugs much faster, maybe in 4 or 5 years. For example, for the ones that take ALK drugs, there are 2 or 3 patients that take a drug for ALK. The drug was approved in 5 years only. And because the evidence is so strong that we cannot wait to have 1,000 patients taking the drug, 1,000 patients taking placebo, and wait 3 years for the difference. That's why, because these are very precise, accurate medications, it was great that the FDA has changed the rules. And in the last 2 or 3 years, the FDA, I think his title is commissioner, and he has been very proactive to side with the patients and try to give you access, faster access to the drugs. In that way, there is something called the right to try. So before say, oh, don't worry, for your protection, you don't take the drug, wait 10 years. Most of the patients cannot wait 10 years. Now, if you want to have the right to try, the drug is more accessible to you. So hopefully we can try as long as we hope it's safe for you, So that's why the horizon is very good for us, and there is a lot of hope. I want all of you to have hope. Don't get discouraged. One day you get bad news from us, but it's one battle that you lose, but you don't lose the war. One battle that you lose doesn't mean that you lose the war. That's what I always tell my patients, okay?
Yes. Other countries, they don't have as stringent rules as we do. Do you know offhand, like what the trial time rate is for some of these drugs, and where are we meaning the United States, in relation to other countries in our advances?
No, the nice thing is that most of our societies are universal. For example, the Lung Cancer Society is only one worldwide. So that's the nice thing. So there is no politics involved because we're only one body. So we do research in more than 100 countries on the world. Some of the studies are multinational. In that way, so we move together. The Asian countries, for example, because they have more numerous population, they accrue faster. So they are a little bit faster to get sometimes drug approvals. For example, these EGFRs, these ALKs, they get approved first in Asia because they have more patients. Unfortunately, China and Japan has huge amount of smokers, so that's why when they do a clinical trial, they accrue very fast. But we benefit from that knowledge because as I said, we embrace what good results they have.
Thank you.
Good evening, all. My name is Victor. I was diagnosed in December 2011, and I had 3 times cancer. Second time, I started to be treated by Dr. Raez and Dr. Botero. And my message to all that are fighting, keep going. You can do it.
Does anybody else have another question or a final thought they want to share?
You know, I've listened to all the testimony of, you know, the trials and, you know, good thing. My message today is hope. And, you know, I got diagnosed shortly after my husband passed away. And I thought it was, and my dad, you know, they passed away 4 days, one on the 13th of February, one on the 17th. And then I thought it was just stress that was giving me this problem. But I have to say, with my husband having Parkinson and, you know, been severe, the support I got from friends and family, and, you know, I have a great support system that it really gave me a thing that one of the things that I want to do, and my message is to help others who doesn't have the support that I had. Because if I didn't have that support, I don't know what, because he needed a lot of care. But we were able to do that as a family. You know, my son, he was in school, he finished his fellowship, and he said, no, I'm moving to Florida, I'm going to be close to that, you know. So he moved down here and worked at Sinai. But even though he come after work and would give me relief, everyone pitched in, you know. So I know there's a lot of families out there that doesn't have that support. And my thing is, being a caretaker, working in the hospital for so many years, my vision is to be a support system for a lot of people, whether to go pick up their drugs for them, maybe take them to an appointment. Simple things like that helps, you know. And that's my hope and that's my goal.
2 questions. One is, where do we donate? How do we know to donate to the foundation? Who we give to, because we do want to donate. And my other one is your theory on food, the way it's the GMOs and the spraying and how we're being fed. Do you feel that that has anything to do with what we're fighting? I mean,
that's a very hard
organic,
question.
you know.
That's a very hard question, because I don't know if you're aware, but there is a huge lawsuit that Monsanto, the company, just lost.
I am very aware.
Because there is people that believe that the pesticides cause lymphoma.
Right.
And you know, we don't do lymphoma here. That's why I don't know how accurate is the finding, but it's very hard to know, because we are exposed to so many chemicals in the world nowadays that it's difficult to do a study to prove exactly what we should eat, what we should not eat. And even there is more complicated than that. I don't know if you're aware, but for example, when we give you immunotherapy for lung cancer or melanoma, any cancer, the type of microbes that you have in your stomach make a difference on which patients are going to respond and which patients are not going to respond. For example, if sometimes we give you antibiotics before the immunotherapy, you kill a lot of the good guys. So for some reason, the proliferation of the bad guys makes that the immunotherapy doesn't work very well. So that's why it's amazing, the things that we have to discover in the next years to come to be sure about what we should do and what we should not do. It's a very difficult judgment, you know. I don't know what to say. Some people say that, oh, I don't want to eat candy. Okay, don't eat sugar, but don't lose weight. You know? Some people want to take alkaline water. I say, I guess it won't hurt you to take some Fiji water, so drink the Fiji water, you know. But it's very hard for us, because as doctors, we don't have 100% evidence that which foods or which beverages or what things we should do or we should not do, you know, because to study, to prove something, as Dr. Domingo said before, you need, I don't know, you need to study with 100,000 people or something to prove what you should drink, what you should eat, what you should not eat. It's very complex, you know.
Yeah, I feel like I ride the middle of the road, like I'm taking the targeted drug. I was afraid to do radiation, but I was okay with the cyber knife, and it did work. But I always read sugar feeds cancer. And I don't try, I stay away from sugar. I make sure of it, I stay away from dairy. Inflammation is another thing that I think causes cancer in the body. Because I constantly read things, everybody tells me, don't read it, just eat what you want. Every doctor's office has candy and stuff, and I don't understand that part of it. It's just,
the candy at the entrance of the Department of Radiation Oncology before you go to the machine, is that what you
Yes.
understand?
I don't understand it because...
Were you the one who complained about that? We have a patient that complained about that. And it's just a tiny candy. Listen, I agree with your statement that the more healthy we eat, the more healthy life. But look at your testimony. You know, talking to you or listening to you couldn't make me feel even that I'm nobody, you know, exercising, yoga, you know, all the things of...
but she didn't talk about food. She could be eating
I know.
sugar.
Well, the things in general, people that like her that are, you know, doing exercising and you eat healthy. The thing is that you get to the point that you don't know what you're buying, what is coming from, what is in that product, what are you really putting right. I think that in general, the statement of moderation, what we say moderation is basically don't go extreme, because I have a patient really that I saw like in 6 weeks lost like 20 pounds, and I said, why you're not eating? And they said, no, I'm eating. And the daughter said, I took all the glucose, basically zero sugar on the diet. The patient was dying of starvation because she wants to kill the malignant cells, taking sugar away, but the normal cells need some sugar to function.
I eat fruit.
No, I'm just saying, I think that is nobody really has the magic recipe. I think that we have to be aware that there's not only this kind of chemicals in the products, there's radiation in the soil, there's radiation when you fly in the airplanes, there's radiation you have the cell phones. I mean, we're totally surrounded. And even if you do everything by the book perfect, still we have cases that you don't understand. The typical thing is, I exercise, I eat well, I'm not obese, I don't drink, I don't smoke, I don't have family history, and here I am, stage 4 lung cancer. Why? We don't have the reason, it's multifactorial, and many times things happen because we're human beings. We wake up every day thinking that the world is for us, and that nothing is going to happen to us. But we're human beings, and every part of our body can fail at any time. So I think that we have to try to do better, exercise a little bit more, eating more healthy, you know, all the things like stress is another factor. And how do you tell a patient that needs to work in order to pay for the insurance and it's a stage 4? I feel sorry because there's people that cannot stop working. They go for the chemo, for the radiation, whole brain, and still they have to go to work. So stress is another factor. So it's multifactorial.
I say I'm retired. I can do this.
Right.
But where do we donate?
That's the last question for... yeah.
Okay.
One more question.
Okay. This is for the navigator in conjunction to what this lady has said. With another organization, well, let me ask, do you have a buddy system or a lifeline system? And what I'm referencing is where someone can call you or text you or email you with their questions or their concerns that aren't necessarily for the doctor or for his assistant, but from another patient. Do you have something like that in place?
Yes, we actually have a centralized number that is available everywhere within our institution. From the time you're starting to see the doctor, we actually provide a lot of information. It's a contact list, including ours. So we have a direct phone number and a centralized number where you can reach out to us. Also, we follow up with the patient. So after the office visits, to make sure you know whatever information you need, to make sure you understand what you need to do, the rationale of this treatment and so forth. So we do have a way to follow up with you, or you also can call us as well. So
Okay, I'm
yes.
not just speaking about a professional, I'm talking about
I can
someone
add to that,
who-
actually, and not to cut you off. Hi, it's me
That's
again.
okay.
Yeah.
I'm coming up from the back. We actually, one of our oldest programs at GoTo Foundation is our Phone Buddy program, and it's been around for almost 20 years. But we match up similar diagnosed patients as well as caregivers to each other based on sex, based on age, based on type of treatment, based on type of side effects that are similar, all kinds of parameters that we use to match you up with the Phone Buddy. And a lot of our Phone Buddies have been around for the whole time, and many for a decade, if not longer. So if you go to gotofoundation.org and look at our support services, you'll find the Phone Buddy program listed
I'm a buddy
there.
already.
Oh, good. Well, there you go.
But I was just wondering for this lady here because she seems like she wants to be of help.
Yeah, so it's both for people that want to be matched and people that want to be a Phone Buddy.
Because, a lot of people give up because they don't have family, they don't have friends, they don't have anyone, so they give in. We could be there for them, and we could prolong it, and we can help them live a more valuable life, just by being there and caring. You don't have to give a lot, but I think that will help. As I've seen where people need family and friends, or just someone to say they care.
Yes, so just to answer your question, as the Director of Supportive Services for Memorial Cancer Institute, we do have a patient advocate who is designed just to speak to patients and advocate for patients, not only from a medical standpoint, but also from a financial standpoint for support. Actually, this person is a cancer survivor herself, so she's able to identify the needs that sometimes other person who hasn't been touched by cancer is unable to identify. So I'll be more than happy to connect with you, because we also have wonderful volunteers. We have a wonderful volunteer program. We have a survivorship program where you can, be plugged in and give back. This is what we call in survivorship a spiritual growth. It's when you're done with your treatment and you're ready to give back because you're thankful for everything you have. So
Great.
we do have someone.
Great. That's great. So I want to thank everybody for coming tonight. Thank our panel of experts up here to talk to us. This has been a really great conversation, everything from screening, and thank you all for listening to our ask of you to make people aware through personalized medicine. And really the conversation happened a little differently than normal, but it happened through you telling your stories. That's where sort of this personalized approach came out and where the conversation really got started. So thank you all again for sharing. I want to do a little bit of housekeeping before we close. Thank everybody online as well for signing in. A few things that we have coming up. We have a living room next Tuesday out in California. We have Dr. Jonathan Goldman coming from UCLA. So if you guys are around next Tuesday, it's 5:30 PST. You can sign in. We have flyers with the links in the back if you don't already watch the living room, and watch us from here while we're out there. On June 10th, anybody who might be watching from California, is our golf tournament in Millbrae. June 22nd, we have our Go-To 5K in Portland, Oregon. And then last but absolutely not least, it's kind of far out, but I wanted to go ahead and mention it, and there's flyers out on the table, our event out here in Hollywood. So we've been doing this for more than 5 years, maybe 7 years now, and we've combined it with a kite fly. So it's a 5K. The team's out there, lots of patients out there. People from GoTo will be there. It's a really fun day. So be sure to grab a flyer and stick it on your calendars for November. Last but not least, I want to thank Beverly Boyd Production for coming out here and setting up all of this gear. They've been here since mid-afternoon putting it all together, so thank you for them. Thank you to the Historic Maxwell Room for hosting us once again. Beautiful as always, and the food was fantastic. The next people I want to thank are people that we simply could not do this living room without. We couldn't bring it to you regionally like we're doing on the road here today, or back at home base in California. So AbbVie, Amgen, AstraZeneca, Bayer, Boehringer Ingelheim, Bristol Myers Squibb, Celgene, Dignity Health, Genentech, Lilly, Medtronic, Merck, Novartis, Takeda, and Tesaro. And a big thank you to FLASCO, the Florida Society of Clinical Oncology, for supporting us at this event here this week. Also, Dr. Raez is a huge part. As I'm sure you heard him mention Bonnie J. Arderi Lung Cancer Foundation and Lung Cancer Alliance now go to several times. He's been a great partner, as has MCI. So big round of applause for this team. There's dessert. You guys make sure you get cookies, and we'll see you next time.